Welcome today to the presentation, Are You New to Medicare? I'm Sheri Yarosh from Partners Senior Advantage, and I'm working today with my colleague Harvey Pearl from Pearl & Company. We're going to go through a presentation that we put together about the basics of Medicare. This presentation is for you, so if you have any questions today, feel free to interrupt Harvey or I, raise a hand. We'll be happy to answer your questions. We'll also allow for questions at the end of the seminar. This is purely an educational seminar today. There's no sales involved. It's just good information for people who are thinking about going on to Medicare. Who are we and what makes us qualified to teach this class? Well, my name is Sheri Yarosh. I'm actually a native St. Louis Park gal. I was born, or wasn't born, but I lived in a house a few blocks from this Lenox Community Center. Went to Fernhill Elementary, Central, Junior High, and St. Louis Park High School. But I went to college, graduate school, and came back to find a career in Medicare in the last 4 years. I'm licensed in the state of Minnesota, Wisconsin, Illinois, and Florida in life, accident, health, and travel insurance. I'm certified in 8 brands of Medicare products in the state of Minnesota. What does that mean? That means I've studied and taken tests and had to pass tests for these companies in order to sell these products. I am a former financial planner. I did that for about a decade before I started to focus primarily on life insurance, health insurance, and Medicare insurance. Before I did financial planning, when I was a young mom with 3 young children, I ran a mental health clinic. I was their administrator for over a decade. So I come to this position with both a background in medical terms, terminology, and financial. I'm also, as a volunteer, I volunteer for Dementia Friends Minnesota. I'm a champion, and I go and I do speaking engagements. Harvey's going to introduce himself.
Good morning. I am licensed also, like Sheri. I am licensed in the state of Minnesota in life, health, accident, and travel. And I am certified in 9 brands of Medicare products. And we're tested every year. We have to pass certification in order to be renewed each year in these brands that we represent. I used to also own a nursing home out east, and I'm a former nursing home administrator, which puts me kind of in a rare position to identify with people as they enter this chapter of their lives. And so we have an agenda today. We'll start with, well, what is Medicare? And how does it differ from health insurance for those under age 65 or just not Medicare eligible yet? We're going to go into the history of Medicare, the ABCs and Ds of how Medicare works. What is the difference between Medigap, Medicare supplement insurance, and Medicare Advantage insurance? How does one qualify at age 65? What are the steps and the processes? When should you go on Medicare? You don't necessarily have to go on at age 65. You can work beyond age 65 for a number of years before you turn on Part B Medicare particularly. And in a case like that, if you are on an employer-based health insurance plan, should you stay on that plan or should you transition to Medicare? And those are assessments that we can do on an individual basis, look at cost comparisons and see which option makes most sense for you. And how do we sign up for Medicare? Just the whole process. We're going to touch on those points as well. Signing up for Medicare supplement plans and signing up for Medicare Advantage plans, similar processes, a little bit different, but those are the things that Sheri and I are trained in. What considerations are there for choosing a plan? The whole idea of Medicare is that it's really individualized. There are no family plans. So even a couple might have 2 very, very different plans because your medications are different, your physicians are different, your preferences are different. So Medicare is very individualized. And so those are some of the considerations that we are looking at when we're helping you choose a plan. Can you change your plan once you sign up, and how often? We're going to touch on those points. What are the costs and advantages of working with an agent such as Sheri or I? And we're going to touch on that, but the heads up on it is that there's no fee for our time. We do earn commission if one buys a policy. It is not an obligation to buy a policy by law. Obviously, we hope to earn your business, but it is not an obligation. But we earn a commission, but the important point is that we're not incentivized from one plan or one brand of product to another. So our role is to be an objective advocate for you. So Sheri, the show is yours.
Okay, so we're going to talk about right now what is the difference between regular health insurance and Medicare. Health insurance can be purchased for all people for under ages 65 who are not yet Medicare eligible. Medicare eligibility is defined as a federal cost-sharing health insurance program that covers both hospital Part A, medical coverage, and prescription Part D costs. Medicare is available for people who are turning 65 and older. You could have a disability and be younger than 65 and go on Medicare, or you could have a certain serious disease, and you could also qualify for Medicare younger than 65. Veterans, if you're a veteran, you have different options, and that's a great question, and I can do a whole presentation on veteran insurance at another time if you'd like. Again, who's eligible for Medicare? U.S. citizens 65 or older, permanently disabled individuals. There's no premium for Part A if you have worked at least 10 years, you or your partner have worked, if you were the domestic partner and stayed at home, raised children and family. As long as you have a partner who worked at least 10 years, or actually it's defined as 40 quarters, and you've paid in. The Part B premium for Medicare is based on your income. Okay, so when we talk to people about that, it's not what your income is at this very moment this year. They're looking back 2 years at what your income was. So if we're talking about 2022, they're looking at your income from 2020. Now, in the U.S. right now, the average person pays $148.50 in 2021. We already know that that fee is going up to $158.50 for 2022. So there is an increase on the Part B premium. Again, just to reiterate, Medicare is a federal health insurance program designed to be a cost-sharing program that covers both medical and prescription drugs. And I need to emphasize it's cost-sharing. There are still costs that you would incur when you're on Medicare. It has evolved greatly since 1965. As we all learned in high school history and civics, Medicare was part of the Great Society that President Johnson initiated in the 60s, but it has evolved. In 1972, there were changes, and it was expanded to allow people who had disabilities or serious illness to go on the Medicare program. In most cases, ultimately, you're going to need to have Medicare A and B, not just one or the other. But there are definitely exceptions. Okay, now, veterans, again, you have additional options, and we can get into those one-on-one or at another time. This is a photo of a Medicare card. Okay, it's a red, white, and blue card. It used to be that people's social security numbers were their Medicare number, but if you look on this card, it's a coded Medicare number. If you ever run into a friend or family member that has their social security number on their Medicare card, they need to get that changed. We're living in a world now where we cannot have your social security numbers that accessible to people. You see on the card, it says the date where Part A begins and when Part B begins. Sometimes that's the same date for most people, but sometimes it differs because someone may take Part A, continue to work on an employer plan, and go on Part B later. Again, Part A, Part B, that's what we call original Medicare. This is probably the most important slide of the whole presentation. It talks about what we call the ABCDs of Medicare coverage. So I'm going to go through them very slowly and give you some hints to remember. When I talk about Medicare Part A, I always say to people, think A, I've been admitted to the hospital, okay? A for admit. Part A Medicare covers your physical plant at the hospital, your room, the electricity, the water. It covers, your stay at the hospital. Now, it also covers hospice care. It could cover home health care after you leave a hospital if you need follow-up care. That would all fall under Medicare Part A. As we mentioned before, there is no fee for most people, no premium for Part A. Part B Medicare coverage is medical coverage for just about everything that you do. If a doctor comes to visit you in a hospital or you go to see a doctor in a clinic, that would fall under Part B. Other things such as getting medication injected into your body in a doctor's office. That would be a Part B medication. Part B also includes things like physical therapy, psychotherapy, I'm stumbling here, medical equipment, durable medical equipment, things like walkers, oxygen, that also falls under Part B. And in original Medicare, when it was set up, Part B is set up to cover 80% of your costs. 80% of your costs still leaves 20% for you, the consumer, to pay if you just get original Medicare. Now, when this was set up in the 60s, maybe a person had $1,000 worth of bills in a year for medical. Medicare would cover $800, and that person would be liable for $200. We're living in a different society now where a person could incur maybe $100,000 worth of medical bills in a year. If you just have medical, original Medicare A and B, you could then be liable for $20,000 worth of medical bills. That's a very difficult position to be in. That's why there's a whole marketplace for Medicare supplements, okay? And Medicare supplements help people deal with the financials of that 20% of Part B and other things as well. Part D, I'm skipping over C, but Part D is prescription drug coverage. So that's a pretty easy one. Think D, drug. Prescription drug coverage programs can either be embedded into a Medicare Advantage plan or they can be a separate standing program. Prescription drug coverage covers all the medication people take outside of a doctor's office. So it's the things you get at the pharmacy. It does not cover things like supplements, aspirin, that sort of thing. It is prescription medication. Generally, if you're on original Medicare, you would get a separate Part D program. And sometimes you'll get a Medigap supplement to pick up the extra 20% that Medicare Part B, that Medicare doesn't cover under Part B. That was the type of program, Medigap supplements, that all of our parents' generation really had to buy because it was the only thing in the marketplace. And we'll talk more about Medigap supplements. Now, 15 years ago or so, another alphabet letter came on. It's called Part C, Medicare Advantage plans. What Medicare Advantage plans are: CMS, or the Center for Medicare and Medicaid Services, they give up the control to a private company to administer, Hannah, who's sitting in here, her Medicare, okay? So the private company takes over the responsibility and the risk for managing your Medicare. It's no longer the official government program. It is a program that is run by a private company. This is the competitive marketplace where you get a lot of postcards, a lot of advertising, right? If you're turning 65, you're going to get bombarded. And also, this time of year, it's October. It's open enrollment. You'll hear more about that. So there's a lot of advertising about Medicare programs. These are primary Medicare Advantage programs. So they are private companies that take the rights and the responsibilities and the administration of Medicare onto them, and people can become part of their programs. They're very network driven. That means if you go, for example, to Alina doctors, you want to make sure that you pick a Medicare Advantage program that takes Alina doctors, okay? Some programs are very broad. They take multiple different programs. You might have mHealth Fairview and Alina and Health Partners all under that program, and some of them are very specific. Medicare Advantage programs vary in cost from zero premium on up to a couple $100s. So there's a wide range, and guess what? The more you pay for your premium, the less you pay for copays. The less you pay for a premium, the more you're going to pay for copays. So I like to always go back and remind people that a Medicare Advantage program is like using an a la carte menu at a restaurant, okay? You pay kind of as you go. As you use the program, you pay. Whereas when we talk about Medigap supplements, which is the other way to get Medicare, it's more of the buffet approach. You pay a certain premium every month up front, and then you don't have any more bills. You can use it as much or as little as you like. You're going to hear more about all of these. Again, I promised you we'd do some review. Again, Part A, inpatient care in the hospital. Skilled nursing facility care, that's temporary skilled nursing facility care, like if you went into transitional care after a hospital stay. Hospice care, home health care. And again, to reiterate, most people do not pay a premium for Part A. Part B Medicare is services from doctors and other healthcare providers. They could be therapists, they could be speech pathologists, outpatient care of every sort, home healthcare possibility, durable medical equipment, again, that's things like a CPAP machine, oxygen, walkers. Part B includes preventative services, oftentimes screenings, and everybody, just about everybody, pays a premium of some sort for Part B. Now, if you are in a financially hardship situation, you may not pay as much of a premium as the average person. And again, and if you earn a certain amount of money over certain thresholds, and we can talk to you about that one-on-one, you may pay a higher premium than the average. Medicare Advantage programs, again, to reiterate, they assign Part A and Part B benefits to a private plan that administers your health care on behalf of Medicare. They may include Part D coverage or they may not. Most plans do include Part D coverage, but for example, there are specific Medicare Advantage programs that are designed for veterans who get their medication through the VA hospital system. So they don't necessarily need to have Part D coverage as part of their Medicare Advantage plan. Just to reiterate, Part D, drug coverage. It's an optional plan, but there are penalties for late enrollment. What does that mean? Sometimes I'll meet somebody and they'll say, I don't take any prescription drugs. What do I need to get a Part D plan for? And I say, well, I understand where you're coming from. However, in your life, you may need some medication at some point. It's always better to take the plan when you're first signing up for Medicare because you will have a penalty later on for late enrollment. And those penalties can get pretty expensive after a couple decades. So I would always encourage people to take a Part D plan. They're not included in original Medicare. There's an additional monthly premium when you buy a Part D program. This is probably the most important thing to know about medication under Medicare and Part D programs. Each prescription drug plan is different. Each company has a different formulary to say which drugs are covered by its program. And guess what? Those formularies change annually. So right now during open enrollment, I have a stack of files to look through to make sure that my clients' programs are going to work for them in the upcoming year. You may qualify for extra help with your prescription drug costs. And if that's something you need more information about, approach Harvey or I after the seminar and we'll be happy to give you some information. Again, these Part D prescription drug programs are regulated by Medicare, but they are provided by private insurance companies. Harvey's going to come on up.
Medicare Supplement Medigap plans. These are interchangeable terms. You'll find that in the world of Medicare, there's multiple names for the same thing. So it's very easy to use the incorrect description when people are asking about plans. So the Part C Medicare Advantage plan that Sheri was just talking about, that's one kind of Medicare coverage. Medicare Supplement Medigap plans is the next one we're going to discuss. One of the major benefits of this plan is that there is no network. There is no pre-approval on seeing a physician anywhere in the United States. So you have no limits. You can travel, you can move to another state, Medigap goes with you. You can spend months at a time in another state as a snowbird, and Medigap goes with you. So it doesn't matter where you go. The magic question that you always have to ask is, do you accept Medicare? And that's like the password to get in the door. And the reason why the question needs to be asked regularly is because there are times when physicians decide to stop accepting Medicare. And so it's a question that you should get into the habit of asking all the time, do you accept Medicare? If the answer is yes, then you're covered by the plan. You pay for the same covered services no matter where you are in the United States. So, to Sheri's example of the all-you-can-eat buffet versus the a la carte menu, in Medicare Advantage Part C, you pay as you go. You pay for each item at a time. Every time you see the doctor, you pay a copay. In Medigap, you've got the buffet plan. You're paying one fee to walk in the door, eat as much as you want. So in Medigap, if you see the doctor a few times or a lot of times, it's still costing you the same. Your premium is just consistent month after month. So the analogy that I give to people is that there's kind of an opposite relationship between Medigap and Medicare Advantage plans. In a healthy year, a Medicare Advantage plan appears to be fairly inexpensive. In an unhealthy year, it can perhaps be expensive to you. In the opposite case, in a Medigap plan, in a healthy year, a Medigap plan may appear to be expensive because you're paying the steady premium and you're not seeing the doctor very often. But in an unhealthy year, Medigap is just, I refer to it as a bargain because you're paying the same fee and you're getting as many or as limited services as you need. One of the other things that I tend to point out to people in the world of Medigap, if you have a need for a specialty hospital, and let's use Mayo Clinic as an example, or Johns Hopkins in Baltimore, Sloan Kettering in New York, in Medigap, they all accept Medicare. So you have no network that you have to go through pre-approval to go to. You just go wherever you want to go. If you move to a different state permanently, your Medigap plan goes with you. Your prescription drug plan, however, will need to be updated for whatever state you move into. But you do not have to change your Medigap plan. And so it is predictable coverage. It is easy to budget for. You know what your monthly expenses are going to be, and you know ahead of time what you're going to be paying for most services. And we should add that with exceptions. There are always exceptions in the world of Medicare. So when you're paying a steady premium in your Medigap plan, there might be an exception where there is a slight additional fee. That's something that you should just be open to accept that those possibilities exist. In qualifying for Medicare, right now in the world of the ACA, Obamacare, under age 65 health insurance, we're living in a world of no pre-existing conditions. So health insurance plans cannot penalize you for having a chronic condition. I'm diabetic, for example. Prior to the ACA, my health insurance premiums were outlandish. They were just impossible. But since the ACA came in, my premiums have gone down. In the world of Medicare, generally speaking, it's all about pre-existing conditions, except for the first 6 months of Part B. In the first 6 months of Part B, and that's where I was saying earlier, Anna, that the Part B is really the ignition of the engine of where Medicare really kicks in, okay? From the effective date of your Part B, the first 6 months, you are accepted as you are. And that's why we use the expression guaranteed acceptance. So in my condition, I'm diabetic, that's considered to be a chronic illness, I would be automatically accepted into Medigap, any Medigap plan. After the 6 months, I would have to go through a medical underwriting exam, and I would flunk. And so they have the right not to accept me. They can deny me because in the world of Medicare, it's all about pre-existing conditions. So there's a rare circumstance, however, if you sign up initially for a Medigap plan, and then you say, you know what, I really want to try Medicare Advantage, Part C. You can convert to Part C, and then if you want to go back to Medigap, you can within a 12-month period of your Part B effective date. So that's a rare circumstance, doesn't happen too often, but it's possible, yes.
So in John's case, he's applied for Medicare, been accepted, but he's not going to start taking Medicare because he's still working?
Right.
Does he have 6 months to decide whether to join Medigap so that he has no pre-existing conditions?
So what I'm assuming is your Part A has started, but your Part B has not. When the Part B effective date goes into effect, that's where the count starts. So Part A, ride it along. Just keep on enjoying it. Work as long as you wish. Past age 65 rather, if you're an employer-based plan, you can continue to go onto that employer-based plan as long as you are working. When you retire, then you must convert into Medicare. Your Part B must begin. If, however, you are in an individual health insurance plan, when you approach age 65, you must enroll in Medicare because you cannot have an individual health insurance plan past age 65. So guaranteed acceptance, You get into the fraternity or the sorority, they hug you at the door, they teach you the special handshake, and you're in, and you're always in. Guaranteed renewable every year. The plan is never canceled so long as you're paying your monthly premium. And a prescription drug plan is referred to as a standalone prescription drug plan. It goes alongside your Medigap plan. It's almost like two crutches walking together. You should always have a prescription drug plan. To Sheri's point, if you choose to not have a prescription drug plan because you take no medications, when you ultimately sign up for a prescription drug plan, they will charge you a penalty of 1% for every month you did not sign up for a prescription drug plan. If you're 2 months late, that's 2%. If you're 3 years late, that's 36%. So it can add up really fast. And so that's why we encourage people, sign up for a prescription drug plan at the beginning. In the initial enrollment period, when you turn age 65, you have a 3-month window on either side of your 65th birth month to enroll in at least Part A Medicare. And that's encouraged. It's not a requirement. Most people do it, some people don't, but the general culture is one enrolls. And this is referred to as the IEP, or the initial enrollment period. There's lots of initials in the world of Medicare. And the answer whether or not you should enroll depends on your situation and what options you have. So again, if you're in an employer-based health insurance plan, in more cases than not, that tends to be less expensive than going into Medicare, but not always. And if you have individual health insurance, you should definitely transition into Medicare. So does your employer have a group Medicare plan? So they have an employer-based plan, and then they have a separate group Medicare plan that some people qualify for. So that's one of the things that we would explore with you in making your plans. Are you part of a union that has a group Medicare plan? Typically teachers unions, city employees, government employees, federal government employees, post office workers, police enforcement. There's some generous, wonderful government plans. I have a client that I've told them, do not sign up for Medicare, stay where you're at. You're in a federal plan, you're golden. You will downgrade if you sign up for Medicare. So there are exceptions wherever we go. Are you a veteran? Part B Medicare will make sense for you, but you don't need a separate drug plan because in most cases the Veterans Administration provides medications at incredibly inexpensive costs because you've earned that privilege. And so in a Medicare Advantage Part C world, there is something called a Medicare Advantage plan versus a Medicare Advantage prescription drug plan. And if you go with Medigap, you would just go with a Medigap plan, no standalone prescription drug plan alongside. And if your answer is no to all the above, then you most likely should enroll in Medicare when you are approaching your 65th birthday. These two websites, Medicare.gov and SocialSecurity.gov, are ways to begin your Medicare enrollment process. They're fairly easy systems. They take about 10 minutes. But we can also assist you if it's getting confusing because I've assisted clients where the system just did not make sense and we had to end up calling Social Security and enrolling over the phone because for whatever reason the computer didn't cooperate. Going to a local Social Security office, which is the way that one gets into Medicare, you enroll through the Social Security system. During COVID, that's been a little bit challenging since their offices have been closed, but you can call them and they will set an appointment with you. It may be a few weeks, but they'll set an appointment with you to call you back and then enroll over the phone. And at that time, you can apply in A and B, or you can apply for A only if you're continuing on your employer-based health insurance plan. Again, if you have individual health insurance instead of employer-based insurance, in most cases, you need to sign up for both A and B. And Sheri, you're on.
Thank you. Okay. Here comes a question we often get, so we thought we would be proactive and answer it for people. Should I stay in my employer's health insurance plan versus signing up for Medicare? Well, whether you should continue on your employer plan is going to require really a cost-benefit analysis. What does that mean? What we have to do, or you have to do, but we can help you do it, is compare the premium of your employer's plan and the coverage you're getting, how much your employer may or may not subsidize your premium, to the premium of going on the Medicare Part B plan on your own and getting either a Medicare Advantage plan or a Medigap. So we have to really look at the numbers, okay? Math doesn't lie usually. We also need to look at the deductibles. The deductible is, you know, on most private plans you have to pay a certain amount out of pocket before the insurance kicks in. What your copay is, that means how much you're paying each time you go to see a doctor or specialist. Coinsurance is a percentage that you pay sometimes for a procedure, or if you go out of network, sometimes you have to pay a 20% of a bill. It's not a dollar amount, but a percentage. We'll also need to talk to you about the network of your employer plan and the networks that are available in various programs on Medicare to see really what makes sense for each individual person. Now, here's the big one. If you are covering other family members and you go on Medicare and off your employer plan, how are those people getting coverage? That's a very important situation that we can also do a cost-benefit analysis. Maybe they're going to go on MNsure. Maybe your kids are old enough to do that. You know, we need to look at those things, okay? So there's a lot of nuances that we need to look at to evaluate whether you should stay on your employer's plan or go on Medicare. But the one caveat is, once you go off an employer plan, you cannot go back on it, okay? So it is a decision that shouldn't just be made casually, okay? You really need to think about it and look at the numbers. Medicare plans. Okay, we've talked a lot about Medigap and Medicare Advantage and the ABCs of Medicare, but here's the most important question when it comes sometimes to Medicare. How do I choose which plan is right for me? Well, there's 4 things that we look at, that Harvey and I look at. We came up with this presentation, so we think these are very important. First of all, the formulary. We always ask people to have your prescription list ready to identify which. We need to know which meds you're taking so we can know which networks are going to work, which plans are going to work. Do you go to Walgreens because it's convenient? We need to know those things so we can help you pick a plan. Or do you don't care what pharmacy you go to, or do you like to get your medication through the mail? Those are all things we need to know about your drug plan in order to pick the plan you're using now in order to help you pick a new plan. Network. We need to know what are your preferred doctors. I say they're the doctors you want to keep. Which clinics, which hospitals, and again, which pharmacies are important to you. Okay, is access to the Mayo Clinic, Rochester, and satellites important to you? And we've made specific mention there of Rochester and the satellites in the metro area. If you want access to the Scottsdale Mayo Clinic, they don't take Medicare, so you're going to have to private pay, all right? So that's a little different. Sometimes people would come back and call me later and say, hey, I want to go to Mayo Clinic in Scottsdale. Well, you can't go there on Medicare. They don't accept it. So, but the Mayo Clinic here in Rochester and all the satellites, yes, they do take Medicare. And maybe you don't go there right now to the Mayo Clinic. You're perfectly fine. But if something came up, where would you want to get your care done? Would it be the University of Minnesota system? Would it be Mayo? Would it be Alina? We need to talk about those things so that hopefully you never have to use them, but we want to have those conversations with you so that we make sure that the network we pick allows you to go where you want to go. If you pick someplace and you want to go, you can always go somewhere, but it might be out of network and it may cost you more money. So we want to be proactive on those questions. Portability. Okay, now we've been living in this COVID world for a long time and travel has changed. Maybe people are starting to travel again, but we generally talk to people about how often you travel, how long is the trip, do you need access to out-of-state doctors for routine visits when you're traveling? What would be something that's a routine visit? Sometimes I have clients that have injections for macular degeneration in their eyes. They need to make sure that they get that done when they're down snowbirding wherever they're going. And the last factor here is budget. What is your budget? Okay, how much you're paying for health insurance now? And what can you afford to pay? Those are important questions. Cash flow matters. As I said, there's premiums that are zero premium. There are premiums that go up to a couple $100s. We need to know what works for you. Now, that's a great question. And last night, I actually texted my cousin who's leaving on an international trip tomorrow who is on Medicare. She's not my client, but she's somebody I care about. And I said, hey, did you purchase a health insurance policy for your trip? No. Do I need one? Doesn't my Medicare coverage cover me? No. It only covers for emergency, very little coverage if you're out of the United States. Medicare will cover, emergency type situation, maybe a difference from program to program. But if you're leaving the United States, you need to get what's called an individual travel health policy to make sure that you are covered for things like being airlifted back to the States. That you're covered if you need, when I say God forbid, a surgery when you're out of the United States. You want to make sure that you have coverage. Actually, after I finish this presentation today, I will be writing a policy for my cousin and her travel partner, okay? Because they didn't even think about it. But that's a great question, and it's something that Harvey and I always like to make sure that people understand. Medicare is great in the States. It's going to cover you most of the time. You may have to pay something, but once you leave the U.S., you need a separate policy. Back to cost, are you willing to pay a higher premium for lower premium, zero copays? Or are you kind of the person who wants a low premium with higher copays? Now, we just talked about these 4 factors, and I ordered them in the way that made sense to me. Harvey and I put this together, but these can vary for each individual, okay? For somebody, maybe portability is super important. For somebody else, it may be cost. These are the 4 factors we look at, and they can vary even amongst a couple. One person may say one is more important, the other may say something else. That's fine. They're just discussion points, okay? These are other things that we talk about with people when they're picking Medicare plans. Dental, okay? Some plans include preventative care for dental, some include comprehensive dental. Vision, do you wear glasses? Do you wear contacts? Do you want to have some coverage for those things? Hearing, do you need hearing aids? Somebody just asked me last night, emailed me and said, hey, I need hearing aids. Will my program cover? They're going to give you a discount in the particular program that you're in, was the answer I gave her. You will have a discount. If you want full coverage for your hearing aids, there's a different program that could offer that. So these are very important things that contribute to a person's health and well-being. Gym membership. We're seeing that this year. I've gotten some emails already saying, hey, I see my program has switched from Silver Streakers to another program. Is my gym part of it? That's something that's very important to people. Sometimes people want to have transportation to appointments or to the gym. Some programs offer those things. Having a healthcare advocate. What is a healthcare advocate? Some companies offer you a person who is assigned to you that gets to know you as an individual, gets to know your healthcare needs, and that person is somebody you can go to for a resource. I always think that if somebody's living alone, or maybe if they're new to the metro area, having a healthcare advocate can be really advantageous. Sometimes they can even schedule appointments for people. It's coming up, more holistic health options. Is acupuncture something that you are looking at? I have a client in her 90s. She wants to be able to go for acupuncture for pain management. So I need to look for a new program for her for 2022. Again, we talked about it a little bit before, but travel. Where do you travel? If it's not out of state, are you going up north? We need to make sure that your cabin, where you spend a lot of time, is close to a clinic where your Medicare program works. Now we're going to talk about enrollment periods. And Harvey already talked about initial enrollment period. That is your birthday month, the 3 months before your birthday, and the 3 months after. So right now in October, we're talking to a lot of people who are turning 65 in January because it's 3 months before, and these are people that are getting prepared to go on Medicare. Sometimes people don't, it's not on their radar. They have their birthday, and then they still haven't signed up for Medicare, so they still have a 3-month window to sign up. If they miss that 3 months after their birthday, they have to wait for the annual enrollment period, which is going to start on October 15th, and it will continue to December 7th. That's always a time that somebody can sign up for Medicare if they haven't gone on it yet, or if somebody is on Medicare, it's a time that they can look and review and should review their program for the upcoming year. New plans start on January 1st every year. There's also what we call special enrollment periods. Those are days that qualify, 63 days after your qualifying event. What would be a qualifying event? What if you're going to retire? You've been on your employer program and now you want to stop working and go into retirement. You have 63 days after your qualifying event to sign up for Medicare. I like to tell people though, if you know you're going to retire, please call me 2 months in advance so we can get this all set up. Harvey's nodding his head. Yeah, let's be proactive, not reactive. Okay, anyone who chooses a Medicare Advantage program during open enrollment or their initial period has the ability to change from one Medicare Advantage program to another one in the first quarter of from January to March 31st of the following year. They also can go off of a Medicare Advantage program and back to original Medicare if they would like to during that period. It's important that people know that because life changes. Sometimes, really, when people that I switch during that period, usually it's a situation where either a medication has changed or they need access to somebody in a different network than they needed previously. I'm going to turn it over to Harvey.
I'm going to swing back for a moment on the question of international travel because it really is an important point that most people are not aware of. One of the Medigap plans that I'm certified with actually has a special, actually two of the plans have a limit of what your exposure would be on an international qualifying event. So if you fall down, go boom in Paris and you need medical care, the Medicare standard is the plan, the private company must pay 80% of the coverage. You're responsible for 20% of the coverage, but these two plans have a clause saying your 20% is limited to $1,000. So if you have a $5,000 bill, 20% is $1,000. If you have a $300,000 bill, 20% is $1,000. So each of the plans differ in different ways. And so these are the things that we're trained in to try to pull those plans and find those plans that fit you versus saying, here's three choices, which do you want to fit into? We want to find the plan that fits you. So this is kind of a good example of why do you need an agent, because Medicare is individualized and everyone's got their own stuff, and that's okay. We want you to have your own stuff. We just want to find the plan that's going to meet those needs. So you need to know if your doctors are in network, the ones that you absolutely want to keep. These are the doctors you've trained for the last 30 years to love you as you are. And they don't have the right to retire because you've trained them so well. So these are your favorite doctors. And we want to make sure that they are in network. And your medications. It really is critical to know both of these because every year medications can be eliminated from a plan, from a formulary, or doctors may leave Medicare. And so it really is important to do an annual review, which is what this particular time of the year is referred to, the annual enrollment period, AEP, October 15th through December 7th, where we are doing annual reviews on every single client to make sure that if there are any changes, we are doing the research for our clients to make sure that their doctors and meds are in network and your expenses are minimized. And quite frankly, you just don't know that from a TV commercial. There's a ton of advertising, and it's great advertising, it's great marketing, and it can be very misleading. So just, you know, if you look at a pamphlet and you say, I like this, I like bicycles, therefore that's the plan I want to go to because that's what they're advertising or on bicycles. That's not the way to pick a Medicare plan. Yes?
Insurance companies have safeguards in place for policies if an insurance agent makes a mistake in errors in omission insurance.
Mm-hmm.
Are people like yourselves covered by errors and omissions?
Yeah.
We have
E&O.
our own individual policies.
Yes, of course we do. And based on our licensure, we're licensed not to screw up. But
if somebody
if
makes
it
an honest
happens,
mistake.
right, and honest mistakes do happen on occasion. And you know what? Then we just find a way to fix it and do our best to make the situation whole. But that's a really great question. I'm glad you asked that because that reality does get in the way. If you want to work with an insurance agent who knows you and can best advocate for you, that's really the best position for you to be in. The quick story I have is a client of mine called one day, and he's on Medigap, and his friend is on a Medicare Advantage plan. And his friend said, I have the best Medicare Advantage plan. I don't know why everybody isn't on my plan because it's the best plan ever, and it does this and this and this and this and this. And so my client called me and said, why won't you let me go on to his plan? Well, it's not my call. We empower you to drive your own bus. We just sit in the back seat and we give directions. But we want to empower you with knowledge so that the decisions that you make, you feel really, really good about, because that's important. But when those situations come up, you want someone to go back to who knows you to say, yeah, this may not be a good idea, and here's the reason why. In my client's case, he has had a history of cancer. And I said, well, you can go to the Medicare Advantage plan, but if you want to go back to Medigap, they will reject you because you have a history of cancer. So, and in looking at the dollar comparisons, your Medigap plan is a much better buy if you stay put. And so his response was, okay, I'm really glad I asked you. And that I had someone to ask who knows me and my stuff. And this is what we're trained to do. We're not biased by one company or program type. We're not incentivized either way. Our goal is to be focused on your needs. And you need to find a person that you connect well with. We all have different personality types and styles and whatever, and that's why there are lots of choices. So technically, Sheri and I are individual agents. We work for different agencies. We are competitors, but our style is to be collaborative, and we like to work together and teach together because there's a lot of people out there, and there isn't one agent that can take care of the whole nation. It's just the way it is. So that's why you have choices, and we want you to find the person that you best connect with. And you don't want to wing it. You just don't want to wing it. Health insurance is just way too important to just kind of throw a dart and see where it lands. Because in most cases, when that happens, people are disappointed. Oh, I thought my plan did this, when in fact it didn't, and that could be very costly. And it doesn't cost you anything to work with an agent because we are paid commission by the insurance companies. I tell my clients, I'm available to you all year round because as life happens, you want to have someone to call and say, okay, life just happened, what do I do now? Because we don't expect you to remember all those details because you're busy doing your own lives. This is what we do, and that's why we encourage people to work with agents. So how is contact made? This is kind of an interesting style. If you're under age 65, there's no contact restrictions. So in other words, you can call us. If we get your name for a friend of yours or whatever, we can call you. In the world of Medicare, state of Minnesota licensure requires you have to call us. So if you have a friend that, you come to us and say, you have a friend that really needs some help with Medicare, our response will be, here's my number. Please ask them to give a call. We're not being snobs. We're not being standoffish. We're not being cocky. We're simply saying the client has to initiate the communication. And that was purposely designed because the intent is that agents should not be perceived as a position of hovering and hounding people. So that's why the initial contact has to be initiated by the client. So you can, call us first. We look forward to hearing from you. Leave your voicemail, send us an email, whatever works. And we have to document how you found out about us. And we have to keep that documentation in your file for 11 years in case we get audited by CMS, the Centers for Medicare and Medicaid Services. They can audit us and say, we're concerned that you're hounding clients. Prove otherwise. We have the documentation of who initiated contact. How accessible is your agent? And this goes back to kind of your chemistry, the people that you deal with. And what we tell our clients is, again, as life happens, pick up the phone. We don't expect you to remember all the details. We're available all year round to assist you. This is what we're licensed to do. And just to reiterate that point, and it really is an important point for me because I don't want ever, I had one client recently who said to me, why are you pushing this plan? And I said, I'm not pushing any plan. I'm identifying a plan that works for you. And he basically said, what are you getting out of this? And I said, I have no idea. That's what my bookkeeper does. She takes care of all the commission processing, and I don't want to know what those numbers are because I don't want to be perceived as leaning a customer from one plan to another. Sheri?
Okay.
You're on.
So where do we go from here? We've been talking to you for a long time, but the most important thing that we want to reiterate is Medicare options should be reviewed every year. Your needs, your lifestyle, your health conditions change. The carriers add and drop medications and physicians every year, okay? So we got to be sure that what worked for you this year is going to work for you next year. The plan you're on this year is not necessarily the same coverage as the new year. Okay, question?
Are carriers only allowed to add and drop medications once per year? Or do they do it throughout the whole year?
It could happen throughout the year. It's not very common, but it could happen. And if that does, they have a process that they must follow in terms of notifying you and allowing you to make a change for your medication. So there is a process they can follow. It does happen. It is not frequent though, okay? Generally, they try to stay on the same schedule because they don't want to make hardship for people, okay? You know, they're trying to work with the consumer as well. And once you're enrolled in Medicare, there we can't say it enough, get an annual review. Now getting an annual review doesn't mean that you have to sit down with Harvey or I or whoever your agent means. That means that you need to get them the information so that they can at least tell you what's going on, okay? That is what I've been spending a lot of time doing this week. I'm sure Harvey is doing it as well. Going through people's med lists, checking their program, double checking their doctors, making sure they're in network. That's the value of having an agent. We're there for you, okay? We want to succeed and we want to build a relationship. That's why Harvey and I are working together to get information out to people. We thank you so much for your time. If you have questions, we are going to be happy to take them and we want to talk to you. Here's our contact information. Feel free to reach out. Even if it's just a question, even if you're only 62, it's kind of time to think about these things. Thank you so much, really, for your attention today, and have a great day. Bye-bye.